Terry, I'm Kim, and I'm going to be your nurse for today. Can you tell me how you're feeling?
I'm okay. My stomach hurts a little bit. I went to Applebee's earlier and got some chicken or something, and well, it really caused some explosive diarrhea. It's really gross. By the way, do you have a cig?
I actually don't smoke, and this is a smoke-free facility. But while we're waiting on your test to come back, is it alright if I ask you a couple questions?
Like what?
I would just like to talk to you about your alcohol and drug use.
Oh, well, I was drinking earlier today, and I was smoking some cigarettes with my girlfriend. So.
Okay, well, is it alright if we talk about your substance use?
I'm not really comfortable talking about that, and what does this have to do with my food poisoning anyways?
We ask everyone who comes in these questions to see if their behavior is risky or potentially dangerous to their health. They're just routine questions that we ask every patient.
Oh, I guess that's fine.
Okay, well, do you ever use any tobacco products?
Yeah, I use some tobacco products.
Okay, and what tobacco products do you use?
I usually smoke some cigarettes and some Black and Milds usually.
Okay, and have you used marijuana, any recreational drugs or prescription drugs?
No, I don't do that. I'm not about that.
Okay, and in the past year, have you had 3 drinks in a day, or 7 drinks in a week?
No, I don't really like to drink. It kind of upsets my stomach, so it doesn't really agree with me.
Okay, is it alright if we talk a little bit more about your tobacco use?
I guess so, yeah.
Okay. How often do you smoke tobacco?
Just a few a day. You know what I mean?
No, I'm not really sure what you mean by a few. Can you elaborate on that for me?
Well, I usually smoke about 2 packs a day, and I don't think it's that bad though.
Actually, 2 packs a day is quite a bit for one person to smoke in one day.
Oh, really?
Yeah, it is. Do you ever feel like you smoke more than you mean to or want to?
Maybe a few times. I think my friends kind of influence me a lot, and they smoke a lot of, cigarettes, and but most of the time it's just kind of like my choice. So.
Okay. Well, have you ever thought about cutting down?
My girlfriend, she gets mad, and she doesn't really want to, make out with me or kiss me, when I've been smoking, but I still don't really see any harm in it.
Have you ever maybe put yourself or even others in danger whenever you're smoking?
Well, sometimes when I smoke, I'm driving, and it can kind of be a distraction. So, and also, I'm over at my brother's place a lot. He's got little kids, and I'm always smoking over there, and it's probably not good for his kids.
So it seems to me that, you drink on occasion and you smoke tobacco daily, which is causing problems with your girlfriend, and potentially causing problems with your brother and his kids since you're smoking around them. Is that correct?
Yeah, that sounds about right.
Okay. Is it alright if we talk a little bit more in depth about your drug use?
I guess we can do that.
Okay.
Yeah.
I'm just a little concerned because your drug use is above the safe limits, and could be negatively impacting your health. So what are some reasons that you smoke tobacco?
Well, I kind of like the feeling it gives me, and it really relaxes me. Because I was diagnosed with depression, really severe depression, and I was in the hospital a couple months ago, but I still don't really see any help or any harm in that.
Okay, so from what I understand, you like smoking tobacco because it's relaxing and it makes you feel good.
Yeah, pretty much.
Do you see any potential downsides to smoking tobacco?
Well, tobacco is really expensive, and my girlfriend doesn't like it, and my employers don't like it either. I'm not supposed to smoke at work, but I do it anyways, and so they've been kind of talking about maybe letting me go because I'm not stopping at all.
Okay, so you say it's an expensive habit, and your employer is contemplating letting you go because of your drug use. Have you ever thought of cutting back because of those reasons?
I've thought about it, but I don't really know how to cut back. I've tried before, and it's really, really hard. But at the same time, I almost don't want to cut back because I feel like people just want me to, and I don't know if I want to.
I understand that. You said that the smoking is causing some issues with your girlfriend.
Mm-hmm.
How do you think that the smoking is affecting that?
Well, whenever I smoke, I smell like it, and I smell like it all the time, and my girlfriend really hates it. And like I said, she like doesn't want to do anything with me, like sexually. And plus it's, we don't really make a lot of money, and the money could go towards other things like our rent.
Okay, so from what I understand, your girlfriend gets upset at you for smoking cigarettes because you spend too much money on it, and she doesn't like how you smell after smoking.
Yeah, I guess.
Okay. Has it affected anyone else in your life? Maybe school or?
Well, yeah, I'm in some classes, and I typically smoke before class, and students don't want to sit by me because I reek of cigarettes, and also we're not really supposed to have tobacco products where I live, and so I always kind of worry about getting caught because there's no smoking signs everywhere.
Okay, I understand. It seems that smoking can really jeopardize your social life, and I'm concerned that smoking is having some negative impacts on your social life as well. Would you consider cutting back?
Yeah, I might start thinking about it, because I really don't want to lose my girlfriend. She's, like, really hot, and I love her,
That's great. Smoking can also cause some other health problems, such as hypertension or high blood pressure, poor wound healing. If, for some reason you'd gotten in an accident and needed to heal, the smoking cigarettes would slow down the rate that you would heal. And also heart disease and respiratory infections.
Okay. Well, that doesn't sound really good.
No,
So could it mess up with my asthma?
Actually, I did notice in your chart that you do have asthma, and smoking can just cause a more negative effects on your respiratory system because your respiratory system is already compromised with the asthma. Okay, so here is a readiness ruler. A 0 means that you are not ready to change at all, and a 10 means that you are almost ready to, or you are ready to change. So where would you put yourself on this scale?
I'd say probably like a 4 or 5.
Okay, and why would you rate yourself a 4 or a 5 rather than a 0?
Well, I don't want to lose my girlfriend, and she really wants me to stop, and I think I might want to change,
That's great. Great to hear. What steps do you think you could take, to go in that direction?
Well, maybe changing the people I'm hanging out with, because they all smoke, and maybe keeping track of how much money I'm actually spending on that, because it's a lot of money.
Okay, that sounds like a great start. You said you like to smoke to relieve stress. Do you have any other ways that you can, relieve some stress? Anything you like to do in your free time?
Well, I used to like, lifting weights and stuff, but I really don't have any motivation to do it anymore.
Okay, maybe you could try to get back into the gym or, get some home weights and rep out a couple before you go to work in the morning.
Okay, I think I could do that. I really miss, pumping iron and getting big,
Yeah, I know this can be a difficult thing to talk about, but I appreciate you sharing this with me. Could we maybe schedule an appointment with your regular doctor and see if there's a support group or something that you're interested in?
Sure, I could look into that.
Okay, great. I'll give you some information on some possible groups that might be able to help you. Thanks again for talking to me. I'm going to go ahead and let the doctor know that you are ready to talk to him.
All right.
Thanks.
Thank you.